On October 28th, the U.S. House of Representatives Rules Committee released its draft of the Build Back Better Act. This is the $1.75 trillion social spending package. It's been talked about often in the same conversations as some of the infrastructure bills working its way through the U.S. Congress. This draft that comes out of the House Rules Committee reflects weeks of negotiations between Congress and the White House on the size and scope of the package. The text is not yet final. There's going to be more conversations before it's a done deal, before it works its way out of the House Rules Committee and then eventually to the full House. There are a lot of private health insurance pieces in the Build Back Better Act, which is what we're talking about here today. Included in the act are actually a wide range of policies designed to improve the Affordable Care Act's marketplace plans. They enhance the accessibility and affordability of private health insurance, building on and strengthening the Affordable Care Act. And let's take a look at a couple of those provisions. The first one is big. It enhances the premium tax credits. This is one of those affordability enhancements that we just mentioned. The act would extend the American Rescue Plan Act's premium subsidies through the year 2025. This would mean $0 premiums for people that are a little bit lower income, between 100% and 150% of the poverty level. The premium contributions would be capped at 8.5% of household income for families that are over 400% of the federal poverty level, meaning that more premium tax credits are available to more people. Now, there is another big provision in Build Back Better that is filling the Medicaid gap. The act would help those 12 states that did not expand Medicaid. It would help people in that Medicaid gap get coverage by making them eligible for premium tax credits and cost-sharing subsidies on the Affordable Care Act's marketplace. So those people between 0 and 138% of the federal poverty level would be eligible for a $0 premium plan in 2022. And then there are measures to make sure that their health care is affordable in the years 2023 through 2025, looking more at the actuarial values of those plans. Now, there are even more provisions around that, filling that Medicaid gap in the Build Back Better Act. Lower income folks could be eligible for financial assistance, even if they have an offer of employer-sponsored insurance. People could enroll at any time during the year if they are in that lower income category. The benefit design for people with lower incomes would look more like Medicaid benefits. It would include stuff like transportation benefits. And there is also increased outreach, marketing, and support to the navigator programs in these states that would be working under this Medicaid gap filling provision. Now, there are other health insurance pieces in Build Back Better. Improved access for those with unaffordable employer-based insurance, making more people eligible for premium tax credits, more flexibility in reconciling premium tax credits at tax time, extending the American Rescue Plan's additional premium tax credits and cost sharing to those people that get unemployment benefits through 2025. Expanded consumer assistance with funding for state-level consumer ombudsman programs, creating something called the Improved Healthcare Affordability Fund, which would essentially create grants to states for reinsurance programs or to reduce consumer cost sharing in private insurance. It would also make some changes to the way that the modified adjusted gross income, that MAGI calculation, is done, and expanded enforcement of mental health and substance use disorder parity. And of course, there is so much more in Build Back Better. These were just some of the provisions that touch the Affordable Care Act. Also included are things like enhancements for maternal health, public health preparedness, healthcare workforce enhancements, higher education, more funding for the National Institute of Health, and so much more. But like we said, it's not a done deal yet, so stay tuned. More details to come when this bill is eventually enacted. You can read the version we're talking about, the version that came out of the House Rules Committee. We link to it in the description below. There are also some very important blog posts that go into much more detail on many of these provisions, specifically the Affordable Care Act provisions. We also link to those in the description below.